hey, maybe you have wisdom teeth or have a child who have wisdom teeth. Maybe you're having symptoms. I want to give you some insight here as to what I like to tell my parents of the patients who might have wisdom teeth. So whenever I'm looking at the x-ray, this is somebody who's probably about 16 to 18 years old. As you notice, this is the first molar here. This comes in at 6 years old, long developed roots. This one typically comes in at about 12 years old, the second molar, and then this is the third molar, comes in around 18. Now in this situation, you can see the roots not fully developed. This is an ideal time to have them removed. One reason is because the age of the patient, the bone is a little softer, everything is just heals quicker, and the tooth right here is not fully developed. It's not rooted in. So you think of like taking out a weed in the yard. If you get it when it's small and early and the ground's wet, it comes out easy. That's like a 16 to 18 or 21-year-old. Past that, you start to get longer roots. So you can tell this root is fully developed, this one will get that way. Now getting that out becomes a lot more traumatic, and the bone also might not be as soft. So these are some of the reasons why you should go see your dentist. Check out your wisdom teeth, especially if you're in those years where we recommend to have them out. If you have room for them, great. A lot of people don't. And if they're coming in at any sort of angle, that's going to create problems. You don't want to wait for it to start hurting you, because by that time in your 30s or so, you've got fully developed roots. You might have a really higher incidence of paresthesia, which is like numbness, permanent numbness, or just really painful experience. So try to be preventative and have it done early.